I'm Bobby Connor for South Carolina Public Radio with Health Focus here at the Medical University of South Carolina studio in Charleston. Research has shown that alcohol use during adolescence causes changes in brain structure and function. To talk about alcohol and the adolescent brain is Dr. Lindsay Squiglia. She's a clinical neuropsychologist and assistant professor in the Department of Psychiatry and Behavioral Sciences at MUSC. Dr. Squiglia, can you tell us how the adolescent brain normally develops?
While adolescents may appear to be fully grown physically, we know that their brain continues to mature until about age 25, and this ongoing brain development happens to coincide at a time when kids start to drink, usually.
How does drinking alcohol impact the brain development of a teenager?
So our research has shown that alcohol use during adolescence and young adulthood can interfere with the way that the brain normally develops. So we use magnetic resonance imaging, or MRI, to be able to peek inside the brains of these teenagers and see how alcohol can affect normal neural development. In one of our longitudinal studies, we examined the brains of youth from ages 13 to 23, and we found that kids who started drinking during adolescence showed structural and functional differences in the ways that their brain developed compared to kids who remained abstinent over about that 10-year period. We also found that teens who started drinking did worse on a number of cognitive tests, including tests of memory, attention, and spatial skills, and it took them longer to complete the test than their non-drinking peers.
And what is it about an adolescent's use of alcohol that might be different than adults and particularly problematic?
Adolescents drink in much larger quantities when they do drink, so we call this binge drinking, which is defined as 4 or more drinks on an occasion for women and 5 or more for males. So we know that binge drinking has the most pronounced effects on normal neural development.
And how does this research about teens and alcohol help?
So we know the younger that a child starts drinking, the worse the outcome. So for example, youth who start drinking before age 15 have a 4 times more likely chance to become an alcoholic than kids who don't start drinking during adolescence. So the longer that you can delay the age that youth begin drinking, the better the outcomes. And teens are up to 42% less likely to abuse alcohol if parents talk to them regularly about the dangers of use.
And what about conversations between parents and kids? Any advice on how to best approach that kind of conversation in the family?
I often tell parents of teens that you want to try to engage in these conversations when you're doing other things, so it's not a sit down, but bring it up in normal conversation. So when you're driving, walking the dog, so it's not accusatory, it's more just interested to learn about what their experiences have been with their friends, or if they know other people at their school who are drinking, and talking to them about the possible dangers of drinking when they're young.
And is that the most important message that teens need to hear, is that there is a negative impact on their health?
I think that it's important. Previous interventions have included things like Just Say No and DARE, and those were not as effective as educational programs have been, telling youth this is what happens to your brain when you're using alcohol and your brain is still developing.
Dr. Squiglia, thank you for providing this information about alcohol in adolescence.
Thank you.
From the Medical University of South Carolina studio in Charleston, I'm Bobby Connor for South Carolina Public Radio.
Live from NPR News in Washington, I'm Joel Snyder. Today's attack in the Iraqi capital is being claimed by Islamic State militants. NPR's Alice Porter reports a double bombing killed at least